Okay, everybody, well, welcome to the second session. Again, my name is Ksenia Kastanenka, and I'm an assistant professor here at Massachusetts General Hospital and Harvard Medical School. And today I have a very exciting story to share with you. It is a collaborative story with Neurobo Pharmaceuticals and Dong ST. And the title of my talk today is Therapeutic Treatment with NBO2 is Effective at Slowing Alzheimer's Progression in the Mouse Model. So today we will be talking about a drug, actually a mixture of herbal botanicals. And one of those compounds is a mulberry bush, as can be seen here. So let's talk about Alzheimer's disease. Alzheimer's disease is a major progressive neurodegenerative disorder that is a major cause of dementia. It is characterized by deposition of extracellular deposits, amyloid plaques, composed of amyloid beta, and intracellular inclusions composed of hyperphosphorylated tau, the neurofibrillary tangles. There's substantial cell death that occurs in the course of Alzheimer's disease, and that can be appreciated here when we compare a brain of an Alzheimer's patient to that of a control individual. In addition to these major hallmarks of Alzheimer's disease, more subtle changes have recently been elucidated. And one of those changes has to do with disruption in neuronal calcium homeostasis. As you know, neurons keep their calcium within a very tight range, and that is very important for healthy neuronal function. So what happens in the context of Alzheimer's disease is that the calcium homeostasis gets disrupted, and that leads to elevations in basal calcium levels. In addition, there's substantial neuroinflammation, that is activation of microglia as well as astrocytes. So calcium hypothesis of Alzheimer's disease was coined by Zevin Khachaturian in 1994, and it was revised by Alzheimer's Association during their calcium hypothesis workshop in 2017. It states that sustained changes in molecular mechanisms that regulate cellular calcium homeostasis beyond the normal modulations in the cellular calcium that occur during the typical depolarization and repolarization cycles of a healthy neuron play a critical role in many of the neural dysfunctions underlying chronic brain disorders and aging, such as Alzheimer's disease. So calcium hypothesis implies that genetic risk factors, such as those in amyloid precursor protein gene, PS1 and PS2, as what you will hear in our second talk today from Martin, ApoE4, these result in generation of amyloid beta. Amyloid beta impairs calcium homeostasis within neuronal and non-neuronal cells. And that leads to misregulation of neuronal calcium sensors and impairment of neuroprotection, impairment of dendritic growth, impairment of synaptic connectivity, synaptic plasticity, and ultimately network activity. This leads to cell death and cognitive impairment that can be monitored in Alzheimer's patients. So in the laboratory of my mentor, Brian Baskey, Kishore Kuchibhotla used a ratiometric calcium sensor called yellow chameleon, and he expressed that calcium sensor in the neurons in healthy wild-type mice, as well as in the mouse model of Alzheimer's disease, the amyloidosis model that carries the Swedish mutation in APP gene and delta 9 mutation in the presenilin gene. This particular mouse was generated by Joanna Jankowski and David Borchelt, and you will actually hear from Joanna later on in this series of symposia. So what Kishore found was that in the healthy wild-type animals, majority of the neurons had normal healthy calcium levels, shown here in blue. So the neurons are color-coded according to their intracellular calcium concentration. Neurons like to keep the calcium within the 100 nanomolar range. So all the blue neurons have healthy calcium levels. And as you can see in the APPPS1 animals, Some of the neurons had normal levels of calcium. However, there was a small yet vulnerable neuronal populations that exhibited calcium elevations, shown in yellow and in orange. And the way these images were acquired was using high-resolution multiphoton microscopy, which we use in my laboratory through cranial windows in either anesthetized or awake animals. And the way we describe the calcium concentration within neurons is the percentage or a number of neuronal processes or neurons, and what their intracellular calcium concentration is. That is the ratio of our sensor, which is directly proportional to the intracellular calcium concentration. So again, in the healthy wild type animals, majority of the cells exhibited normal, healthy levels of calcium. Similar was the case for our APPS1 mice, yet in this transgenic, we saw a small population that had what we call calcium overload. And calcium overload is defined as intracellular calcium concentrations that are above a certain threshold. So the percentage of neurons with calcium overload was substantially higher in the APPS1 mice compared to non-transgenic controls. So now we have this calcium concentration, and we use restoration of this calcium overload as a functional indicator of treatment efficacy. And that is exactly what we did here with the NBO2. In addition to increases in calcium concentration due to disruptions in calcium homeostasis, Alzheimer's disease is associated with inflammatory responses. And we monitor those with GFAP immunoreactivity of astrocytes, IBA1 expression in the microglia, in proximity to amyloid plaques, which we monitor with methoxyXL4, or antibodies, or away from the amyloid plaques. So then an effective Alzheimer's treatment would not only halt amyloid plaque deposition, restore intraneuronal calcium to control levels, yet improve the ability of inflammatory cascades to respond to pathology as well. So in comes NBO2. NBO2 is a novel botanical therapeutic. It is currently in preclinical development by Neurabo. It was originated with Dong Ai, and it was called DA9803. So whenever I refer to NBO2 or DA9803, it is the same compound. It has multiple mechanisms of action. It is an acetylcholinesterase inhibitor. It inhibits amyloid beta production. It blocks tau hyperphosphorylation, and it acts as a neuroprotective agent. So it has a number of different actions, and those all act to improve symptoms and prevent disease progression. So what is NBO2? NBO2 is a well-controlled proprietary extract from two botanicals. The first is Morus alba, the white mulberry, and the second is Poriococcus, which is a fungus that resembles coconut. So the question we wanted to ask on our collaborative work on NBO2 is, does NBO2 prevent or reverse Alzheimer's disease progression in animal models of Alzheimer's disease? To answer this question, we carried out the next set of studies. Study number one, the aim of study number one was to determine if treatment with NBO2 prevents plaque deposition as well as calcium overload in young APPS1 mice. And here we monitored extracellular plaques through cranial windows in living, breathing animals with multiphoton microscopy. The aim of study number two was to determine if treatment with NBO2 reverses neuropathology in older APPS1 mice. And here, in addition to monitoring amyloid plaques, we also monitored basal calcium levels within neurons. So let's talk about the first study. Here, we used 5-month-old APPPS1 mice. These animals underwent expression of yellow chameleon 3.6. It was injected into the cerebral cortex of these animals, and craniotomy was installed right over the injection site. The animals were allowed to recover, and then we injected methoxyXO4, which is a dye that crosses the blood-brain barrier and binds to amyloid plaques in the brains of these mice. Right after, we would perform the first imaging session using multiphoton microscopy through cranial windows. And the first session was the baseline session. Right after that baseline session, we would start gavage treatment with 100 mg per kg of NBO2 once per day for the duration of 4 weeks until the second imaging session, and then 4 more weeks until the final third imaging session, after which the animals were subjected to 1 more gavage treatment, and then their brains were isolated and processed for immunohistochemistry. We would image amyloid plaques as well as yellow chameleon, our ratiometric calcium sensor that allows us to determine the absolute calcium concentration inside neurons with multiphoton microscopy. And the working hypothesis was that treatment with NBO2 would prevent plaque deposition as well as neuronal calcium in these young APPPS1 mice. We had a control in addition to treating a set of animals with drugs with NBO2, we treated another set of animals with vehicle. And we monitored the plaques within these animals as well. And what we saw was deposition of amyloid plaques at the baseline. There were a few plaques at these early ages, yet there were already some present. And then we monitored these plaques in subsequent imaging sessions as well. So what allows us to find the exact same fields of view and monitor exact same plaques were these angiograms. We would inject a red dextran into vasculature, and this would allow us to use the blood vessels as landmarks to be able to go back to the same imaging sessions. So what did we find? Well, it turns out that vehicle-treated animals showed an increase in plaque deposition over the course of treatment. So we saw the same plaques over time, yet we saw deposition of additional plaques. And when we monitored amyloid deposition in NBO2-treated animals, we saw something very different. We saw amyloid plaques present at baseline, and we saw one of two things. Those plaques were either present during subsequent imaging sessions, however, there was no deposition of additional plaques, or we saw amyloid plaque clearance. So as you can see here, this is exact same plaque, and this is exact same plaque in subsequent imaging session, yet these two plaques were cleared. So to quantify, the plaque number increased in vehicle-treated animals over time, while the plaque number was stabilized or even decreased in the A9803 drug treatment condition. Similar to plaque number, amyloid plaque burden also increased over time in the vehicle-treated animals, and the drug-treated animals showed a decrease in amyloid plaque burden. The difference in burden versus number is that amyloid plaque burden not only takes into account the plaque number, but also their size. So if the plaques get smaller, we would be able to see that. And that's exactly what we saw. So the plaque, at the end of drug treatment, we saw the plaque number going down in the drug condition and the plaque burden substantially lower. at the end of drug treatment as well. So then we monitored then we monitored intracellular calcium concentration in vehicle and drug condition. And in the vehicle condition, we saw majority of the neurons and neuronal processes exhibiting normal, healthy levels of basal calcium. However, we saw these neurons that had calcium elevations as well, as I mentioned. And interestingly, DNN3, in that condition, we saw very few neurons with calcium overload. Most of the neurons were healthy. And this is quantified here. So if we're looking at the neurons with calcium overload, we start out with a few of those neurons, and in the course of the vehicle treatment, the number of those neurons actually goes up. While in the drug condition, the number of neurons with calcium overload goes down. So that by the end of treatment, we had significantly higher percentage of neurons with calcium overload in the vehicle-treated animals compared to those in the drug-treated animals. So this allowed us to conclude that treatment of young APPPS1 mice with 100 mg per kg, D9803, prevents amyloid plaque deposition, results in mild clearance of amyloid, as well as prevents neuronal calcium overload. So then we looked at the neuroinflammation as well. We wanted to compare the numbers of GFAP positive astrocytes, as well as IVA1 positive microglia in the vehicle and the drug conditions. And to our surprise, we actually didn't see a significant difference. We assessed GFAP positive cell number either away from the plaque or in proximity of the plaque, and we didn't see a significant difference between the vehicle versus the drug condition. We did see an increase in the number of GFAP positive cells near plaques, which is consistent with the literature. And similar to IVA1, we saw an increase in IVA1 immunoreactivity in proximity to plaques, yet we didn't see a significant difference between the two conditions. So then we decided to dig a little bit deeper and look at the morphology of the individual reactive astrocytes and reactive microglia. And we found something very striking. In our vehicle-treated animals, we saw astrocytes with very small cell bodies and these long processes. Compared to these astrocytes, we saw a very short processes in the drug-treated animals and a large cell body. So the astrocytic process length was significantly shorter in the drug condition, and astrocytic cell body diameter was much larger in the drug condition. And similarly, microglia exhibited larger cell bodies and shorter processes in the drug condition as well. Also, in collaboration with Dong Ah, we performed a number of cognitive assessments in young 5X FAD mice. And the idea was to determine whether treatment with 30 or 100 mg per kg NBO2 would restore behavioral deficits in these animals. One of the two tests were performed. The first was a Y maze. And if you're not familiar with this particular assessment, a mouse is placed in the center and it is allowed to freely move into the A, B, or C arm. So what happens is mice like to alternate between different arms. And this alternation behavior is what's recorded. So compared to the healthy wild type animals, 5XFAD mice exhibit less of that alternation behavior. And then when the animals were treated with 30 mg per kg, that alternation behavior actually increased. And then when mice were treated with 100 mg per kg, that alternation behavior increased even more. So we saw a rescue in the alternation behavior in the Y maze. Also, animals were subjected to the passive avoidance test. Here, animals were placed into a light chamber, and mice actually prefer a dark chamber. So what happens is mice tend to walk through this door to feel more safe in the dark chamber. The only catch is, as soon as mice enter the dark chamber during the conditioning part of the test, they're exposed to a foot shock, aversive foot shock. So then during the test, the animals are placed into the light chamber again, and the latency for their transfer into the dark chamber is assessed. During the test, animals are not subjected to the foot shock. So what happens is the latency of wild type animals to enter the dark chamber is quite high. And that latency actually goes down in 5x FAD animals. And if the animals are treated with either 30 or 100 mg per kg DNNA3, that latency went up. So this told us that NBO2 prevented cognitive deficits in these young 5x FAD mice. So to conclude this part of the talk, NBO2 has promising potential as a therapeutic to prevent Alzheimer's disease. And the next question we got interested in, however, can it be used as a treatment? It's great that we can prevent things, but can we treat at least Alzheimer's in a mouse model? So to answer this question, we used older APPPS1 mice compared to the 5 month of age animals in study 1. Here, animals were 8 to 12 months of age. And very similar to the first study, we expressed yellow chameleon in the cortical neurons of these mice, performed craniotomies, and then imaged amyloid plaques, as well as intracellular calcium with multipotent microscopy across the 3 imaging sessions. And again, the animals underwent gavage treatment with NBO2. And the hypothesis was that, again, treatment with NBO2 would slow plaque deposition and perhaps restore some of that calcium overload in APPS1 mice. So now remember here, we would expect a substantially higher calcium overload or more neurons that have those calcium dysregulations. So the question is, can we reverse this with the drug, or are we at the point of no return? So here's the data on the treatment with NBO2. In the vehicle condition, we saw an increase in plaque deposition, although since these mice are older, we didn't see as dramatic of an increase in amyloid plaque numbers over time. In the NBO2 condition, surprisingly, we did see stabilization of amyloid, and we did see some clearance as well. And that can be seen here. The plaque numbers, again, were stabilized over the course of treatment and even went down, and similar, the plaque burden did too. So that by the end of treatment, the number of plaques was significantly fewer in the NBO2 condition compared to the vehicle, and plaque burden was significantly lower. So then at the end of treatment in the vehicle treated animals, we saw an increase in amyloid, while NBO2 condition, we saw a drop in amyloid or clearance of amyloid. So now let's look at the inflammatory responses of these animals as part of the drug treatment. Here, we assessed amyloid plaque deposition with immunoreactivity with CXC10. And the reason we wanted to do that is the multiphoton microscopy allows monitoring of amyloid in the very small cortical volume. Our cranial windows were about 5 to 8 millimeters in diameter. So we wanted to make sure that we see that decrease in amyloid burden in the course of the entire cortex. So to that end, we took the brains out post-mortem in these animals and assessed amyloid plaques with 6E10 immunoreactivity. And what we saw is that methoxyXL4 labeled these dense cores of the plaque, while 6E10, in addition to labeling the dense cores, also decorated the fringes, as can be seen here. So when we quantified the immunoreactivity with 6E10, similar to methoxy, we saw a decrease in plaque burden with NBO2 treatment compared to that with the vehicle. Thus, treatment with NBO2 reversed plaque deposition in older APPPS1 mice when assessed post-mortem with 6E10, which mirrored our findings with multiphoton microscopy. So then we looked at the basal calcium levels within the neurons. And again, in the vehicle condition, we saw neurons with calcium overload. Here's an example of a cell body that exhibits calcium overload. Here's an example of a neuronal process that exhibits calcium overload. So we see this calcium overload not only in neuronal processes, but also in cell bodies. And as you know, calcium can do different things in the neuronal processes versus cell bodies. And hence those functions are disrupted. Yet when we treated our animals with NBO2, again, we saw majority of the neurons that were healthy. They had healthy calcium levels. We saw very few neurons with calcium overload. So here's the quantification. In the course of vehicle treatment, we saw an increase in the percentage of neurons with calcium overload, while in the NBO2 condition, we saw quite a dramatic drop in the percentage of neurons with calcium overload. So that by the end of treatment, there were few to no neurons with calcium overload in NBO2 condition, while there were quite a few. We saw up to 40% of the neuronal processes that we imaged had calcium elevations. So then we looked at, again, immunoreactivity of astrocytes, and here we monitored GFAP in the cortices as well as in the hippocampi. And very similarly, we saw no significant difference in the number of GFAP positive cells in the vehicle or NBO2 condition in the cortex or in the hippocampus. Yet when we looked at the morphology, again, we saw longer processes in the vehicle condition and smaller cell bodies, while the processes were much shorter in the NBO2 condition and the cell bodies were much larger. And we can talk about what that potentially means. Then we looked at the IBA1 immunoreactivity. Again, no significant differences in the numbers of IBA1 positive cells, either in the cortex between conditions or in the hippocampus between conditions. And here again, the IBA1 cell process length was substantially shortened in NBO2 with NBO2 drug treatment, and the cell body diameter was much higher. So to conclude, the treatment with NBO2 prevents plaque deposition, calcium overload, and modifies glial morphology in young APPS1 mice. And the second study revealed that treatment with NBO2 reverses neuropathology in older animals. With that, I would like to conclude and acknowledge the expertise in my laboratory of the folks that contributed to this work. And without their technical expertise, this work would not be possible. And that is the work of Evelyn Lee, Lavender Letivier, and Alyssa Ross. This work was pioneered with Guillaume Pagnier. He was actually a co-first author on one of the publications that I discussed today. And I would like to say special thanks to Alyssa Russ and Maggie Macy for helping me organize this series of virtual symposia. Just a couple of years ago, it was just a vision, and they really made it into a reality. Great work. I would like to thank our collaborators at Dong AST, as well as the folks at Neurabo. Richard Hung, the CEO of Neurabo, was extremely supportive of this work. I would like to thank my mentors at Massachusetts General Hospital, Brian Baskey and Brett Hyman. And I would like to thank our Chief of Neurology, Mary Tsukovich, who was very supportive of these series of virtual symposia. I'd like to thank all of you for your attention, and I would like to thank the funding. This work was supported by Dong Ah and Neurabo, and hence that's where we have the conflict of interest. Also, this work was supported by Brand Focus Foundation, Alzheimer's Association, as well as National Institutes of Aging. Thank you very much for your attention, and I will take any questions that you might have.
Thank you.